Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Exploring the mystery of hiccups. Hiccups, we've all experienced them, those sudden involuntary spasms of our diaphragm, the muscle responsible for breathing. This essential muscle, separating our chest from our abdomen, plays a crucial role in our respiratory system. But what happens when it starts acting up, causing those characteristic hic sounds? These spasms, known as hiccups, occur when our diaphragm contracts involuntarily, leading to a rapid intake of air. This sudden rush of air is abruptly cut short as the glottis, the opening between our vocal cords, slams shut. The result, the familiar hic sound we all know. Although hiccups are usually harmless and short-lived, they can sometimes signal an underlying medical condition, especially if they persist for an extended period. Understanding the causes, symptoms, and potential treatments for hiccups can help us better manage this common ailment. So why do we hiccup? Let's delve into the fascinating world of these involuntary spasms and uncover the reasons behind those mysterious hics. Hiccups, while often transient and harmless, can sometimes linger longer than expected. To understand them better, medical professionals classify hiccups into three main categories based on their duration. Transient hiccups are the most common type, lasting for a short period, typically a few minutes to a few hours at most. These hiccups are generally benign and often resolve independently without any intervention. They are usually triggered by simple, everyday factors like eating too quickly, consuming carbonated beverages, or even sudden excitement. Persistent hiccups, on the other hand, are a cause for slightly more concern. These hiccups last for an extended period, typically exceeding 48 hours. While not always indicative of a serious medical condition, persistent hiccups warrant medical attention to rule out any underlying causes. Intractable hiccups are the most persistent and concerning type, lasting for more than 2 months. These hiccups can significantly impact a person's quality of life, affecting sleep, eating habits, and overall well-being. Intractable hiccups often signal an underlying medical condition, requiring further investigation and specialized management. The causes of hiccups are as varied as their durations, ranging from simple lifestyle choices to underlying medical conditions. Let's shed some light on the common triggers for each type of hiccup. Transient hiccups, the most frequent culprits of those sudden hic sounds, are often attributed to our everyday habits. Eating or drinking too quickly, indulging in spicy or very hot or cold foods, and consuming carbonated or alcoholic beverages are common culprits. Swallowing excess air, also known as aerophagia, can also lead to transient hiccups. This can happen when we chew gum, smoke, or even talk while eating. Sudden excitement, emotional stress, and abrupt temperature changes can also trigger these short-lived spasms. Persistent and intractable hiccups, while less common, often point towards underlying medical conditions or nerve irritations. Gastrointestinal issues, such as gastroesophageal reflux disease, gastritis, inflammatory bowel disease, and small bowel obstruction, are frequent culprits. Central nervous system disorders, including stroke, Parkinson's disease, multiple sclerosis, traumatic brain injury, and encephalitis and brain tumors, can also lead to persistent hiccups. Similarly, lung conditions like pneumonia, pulmonary embolism, pleurisy, and asthma can also be contributing factors. Section 4. Recognizing the signs. When a hiccup is more than just a hiccup, while the characteristic hic sound is the most prominent sign of hiccups, other symptoms can accompany these involuntary spasms. Recognizing these signs, especially when they persist or worsen, can help determine when medical attention is necessary. The primary symptom of hiccups is the unmistakable hic sound, produced by the sudden closure of the vocal cords as the diaphragm contracts involuntarily. This sound, often described as a sharp involuntary gasp, is typically followed by a brief pause before the next hiccup occurs. Along with the iac sound, individuals experiencing hiccups may also feel uncontrolled diaphragm spasms. These spasms, felt as a tightening or fluttering sensation in the chest or abdomen, can range in intensity from mild to quite forceful. In some cases, hiccups can also lead to tightness in the chest, stomach, or throat. This tightness, often described as a feeling of pressure or fullness, can make breathing uncomfortable, especially during episodes of prolonged hiccups. Hiccups can also interfere with essential daily activities such as eating, drinking, sleeping, and even speaking. The involuntary spasms can make it challenging to swallow food and liquids comfortably, potentially leading to discomfort or even choking hazards. Additionally, prolonged hiccups can disrupt sleep patterns, leading to fatigue and daytime drowsiness.